Scary headline alert. Can you imagine going in for prenatal care at the end of the first trimester and getting results back for what you thought was non-invasive prenatal testing to understand the genetics and the health of the baby that you're carrying, but instead you got a cancer diagnosis? That's exactly what happened to this woman. She's actually a doctor, and during her pregnancy she was diagnosed with stage 2 lymphoma. Thankfully, she underwent chemotherapy while pregnant and is in remission and has a healthy baby. So during your pregnancy, during your prenatal care, you're going to be offered a wide array of options for genetic testing. These are genetic tests that are geared towards diagnosing or screening for something called aneuploidy, where there is the wrong number of chromosomes, missing or extra chromosomes. And this can pick up things like Down syndrome, Turner syndrome, and the screening, which is routinely offered to all pregnant women, often can be done as something called a non-invasive prenatal test, NIPT. This is where a blood draw is done at the end of the first trimester, where cell-free DNA fragments from the fetus that circulate in the mother's bloodstream can be analyzed. Prenatal genetic testing can also pick up cancer cells and even cells from benign tumors like fibroids, because tumor cells are also shed. They're shedding fragments of DNA into the maternal bloodstream, just like cells from the pregnancy are. So if you're taking a blood sample at the end of the first trimester, you're going to have a mixture of the mom cells, which are normally there, and you're going to also see these fetal DNA fragments, and those are only going to be there if the woman is pregnant. And then if you have a tumor, you might have a mixture of these 3 different cell types in terms of DNA, and this can really mess up the results. So in a recently published study that included about 100 patients that had similar stories to this woman, there were at least about 50% of the cases that had these weird readouts in their results that had full body MRIs and were confirmed to have some sort of cancer, different types of cancer, pancreatic, lymphoma, etc. Not every patient with an abnormal result was confirmed to have cancer. And so it's important to not freak out if you get a readout that is not typical, but it is important to be aware that an atypical read on this test could mean that there are cancer cells picked up, and it's important to be vigilant for this and have the necessary follow-up. Another thing I want to bring up while I'm on the topic of non-invasive prenatal testing and prenatal genetic testing in general is this idea that if you've done PGT, that the pregnancy doesn't necessarily require genetic testing, and that is not true. So I always tell my patients, whether you used a PGT normal embryo or not to help you get pregnant when you were going through fertility treatment, pretend you never did PGT, and it's always a smart idea at a minimum to do non-invasive prenatal testing in the form of blood work so that you can confirm that everything looks good, and if there are any red flags, if there are any abnormal results, you can then do the necessary follow-up. When we do PGT, we're only sampling a small amount of the embryo, and while it tends to be very accurate, it may not give the full picture. And when you're doing tests like NIPT using cell-free fetal DNA, you can get a lot more data and information, and it's just good confirmation.